Inmediatamente el futbolista tuerce el gesto y cae levantando el brazo, llevándose automáticamente la mano al...
Yes, as we have seen in this video, Neymar Jr. torn his ACL. ACL is a really difficult and unfortunately it's most popular injury in football player. And when they have this injury, they have to work with the crunches until the operation, and then after the operation for a couple of weeks or to a month, they need to carry on with the crunches, and then after that they can stop using it. But let's see how's the therapy plan going, because there's a lot of controversy in Twitter, in Facebook, in TikTok about the rehabilitation process of Neymar Jr.
Volta, pelo amor de Deus, Força, Júlio, vem aí. Força, não vai cair não. Força, Ney. Vamos. Isso, força. Força, Ney. Vamos. Sozinho.
Yeah, I was going to talk about something, but I wanted to finish the video first. After the operation, there is a guidelines and there is like a way to deal with the ACL. The most important thing after the ACL operation, the first week, is to make sure that the patient doesn't have pain and there is less swelling and inflammation in the knee area. And we don't want the patient to put a lot of pressure on the knee in the first week. And the following weeks, because there is no information about which week Neymar Jr. already in this video, so we cannot say that the therapists do the good job or bad job. But the thing is that after the second week, you have to start to do a passive range of motion, which means that there is a lot of machines, the one that you already see in the Neymar Jr. has it as well, that after the operation, they're going to give it to you and then you can adjust the degree of the movement and the machine start moving and you're going to have a passive range of motion during the movement. And that's really helpful after the operation, because the most important part is that increasing the range of motion and make sure that the knee can perform all extension and flexion properly without any pain. But what happens most of the time is after the operation, the body is in a safe zone and the body doesn't want to go to the difficult part. So that's why we have these machines, so we can slowly increase the range. Most of the time we start with 45 degree after the operation and we will add to the degree 5 to 10 degree every 2 or 3 days. Depends on the patient response. Sometimes it's more, sometimes less. But the purpose is that using the machine to go until 90 degree and then after that to 120. We say that most of the time it's like good to have 90 to 120 degree in between 2 to 3 weeks. But sometimes patient cannot handle that and we have to drop that percentage and that expectation. So we do it less than that sometimes, but that's the main goal, to reach to between 90 to 120 degree in 3 or 4 weeks time. And that's really important to focus on the extension part. Anyway, there is a lot of machines and equipment that the therapists use to do this range of motion, especially the passive range of motion. We have isokinetic machine, we have CPM machines, and these are really easy to use. Some of them, they're really accessible, so even the hospital give it to the patient after the operation. They can bring it to the home and do training at home. Some of them, they are a bit heavy and bigger. We have it in our center or any other center, so the people can go there, the patient can go there after the operation and use the machines.
Das 10 da manhã até as 10 da noite, mas já também,
This video is probably 1 week after the operation because he has still the stitches on, and this is one of the way that we work on the patients. We want them to actively use their quadriceps muscle to bring the leg up in the extension position. It's quite hard sometimes after the operation because the muscle cannot contract it properly. And one of the most important thing after the first or second weeks of operation is to make sure that the patient can go to the full extension. Sometimes we can do that with passive range of motion. It's going to be easy. It's going to be it's not going to be hard, but sometimes it's going to be quite difficult because the body is really against the movement after the operation, and the body doesn't want us to push it. So that's why we use this active movement as well to contract the muscle and then try to bring the leg and do the extension on the knee as much as we can. So that's what Neymar Jr. is doing right now. As you can see, he tried to contract the quadriceps muscle and then do the extension, but because it's after the operation, the range of motion is not that much. Until now, they're doing perfect.
Com Neymar,
That's what I said as well. Like after the operation for a couple of weeks, you need to be on crunches, and depends on the patient response to the movement, to the therapy, they can be without the crunches. Alright, let's talk about the first two parts, which was the crunches and also the trapeze try to push the knee to the flexion position. The crunches, as I said, is completely normal, and they can have it for like 1 month after the operation as well. But we prefer to ask the patient to stop using the crunches after 2 weeks. But the second part, which was the therapist trying to push the knee to the flexion, I'm not going to say that I'm against it, but I prefer most of the time to do this in a passive range that the patient cannot understand it. When you use a machine like isokinetic machine or CPM machine, you can adjust the degree without the patient doesn't even know about it. So the patient can go to the higher range of motion without even notice it. But if you do it actively, what happens is that the body is gonna work against your force. You try to push the ankle backward to flex the knee as much as you can, but what happens is that the whole body try to be against you, and then the muscle, they're gonna get really hard and they're gonna stop you doing that, which I believe is not a good way to do it. And depends on the pain threshold. Sometimes we said that it's good to go until like 4 or 5, but there is like unwritten rule that we don't want to go more than 5 and 6 because we want to be in the safe side. Most of the time we said it's better to be safe than sorry, and that's the case here as well. So most of my ACL patients, I try to push them until like 3, 4, and what I do is I try to distract them and let the machine works. So probably what I do is I start with a degree that they are comfortable, and then I manually increase the degree in the machine, and I try to distract them while talking with them and then just discuss some stuff. So they will increase the range without they noticing, and then the body is not going to be against them as well. But the third part that we are going to watch is the wildest one. Oh my gosh. Oh my gosh, what can I say? I'm kind of against this way of therapy. I'm not going to say that I'm right or wrong, or they are right or wrong, but I believe that it has to be a way and it has to be a concept of work. The two part that we saw, the first one was, I believe it was the first 2 weeks, which the flexion and extension was really bad. But the second video was like at least a month after the operation. And Neymar was crying during that, which is really, really difficult to watch.
Godfather, I don't know what to do. I don't know what to do.
You can act like a man! What's the matter with you?
And I believe that it's quite unusual to do this way or this type of therapy to someone. Because as I said before, the purpose of the therapy is that to let the body heal itself, and we help the body to do the process of healing faster and better. So if we push the body that far that the person starts crying or screaming, it doesn't mean that we are doing a really good job. It means that we try to push the body in a way that maybe is quite dangerous. We have to bring the range of motion in a natural ways, not with the pushing two person just grab the upper body, one person pushing from down and then just try to flex the knee as much as they can. It's quite dangerous, first of all, and if it's not dangerous, it's not going to be useful as well, because the body has like a memory and the body all the time try to be in a safe zone. So what happens whenever you push the body to the position that it doesn't want to be, it's going to react and it's going to be worse during the rehabilitation. So what we want is that to make sure the body is relaxed enough so we can control the movement and also push the body as much as we want. We don't want the body to be against us. So that's why I'm completely against this type of therapy, and I believe it has to be done really slow, with control, and also make sure everything going properly. I told you about isokinetic machine. This is one of the way to use it, but this one is already in the stage 4 of ACL operation, which we ask the patient to do it actively, the movement. But we can put the machine in the fixed position that the patient can do isometric exercises as well. And then also we can use the CPM to make sure we increase the range. Let's look at another clip of the isokinetic. This one is like passive range of motion with active movement as well. And as you can see, you can increase the range, you can increase the pressure after the ACL, and you can control the strength as well. So you slowly build up the strength, you slowly build up the movement. You are not going to push it, because at the end of the day, if a person is going to push you in the flexion or extension, there is no measurements. They just grab the ankle and they're pushing it. But with the machine, you can say that, okay, yesterday I have done, 60 degree. Today I'm going to go to 65 and slowly build it up. But if someone push you, you don't know how far you have gone and then how much you need to push yourself today. So that's why I believe it's quite dangerous to do the way that Neymar is doing right now. Hope you enjoyed this video and see you in the next one.